Welcome back. In today's medical moment, to coincide with World Stroke Day, which is this Friday, Spectrum Health is working hard to spread awareness about its stroke services and how they can provide high-quality care and expertise to stroke patients throughout West Michigan. Here to speak with us is Dr. Nabil Wees, a vascular neurologist at Spectrum Health Butterworth. Good morning to you, doctor.
Good morning.
Good morning. So what's new at Butterworth in the realm of stroke care?
So our vision is always to provide a high-quality care to stroke patients and a safe care regardless of the Spectrum Health site they come to. As stroke specialists, we're always available 24/7 over the phone. And over the past 2 years, just before or around 2 years ago, before the COVID hit, we started an inpatient Telestroke service consultation in all of our Spectrum Health regional hospitals, giving us the platform to evaluate stroke patients who get admitted to the regionals with help of stroke-trained nurse hands-on, and giving us the opportunity to provide our expertise, ordering tests, and even with technology to share brain images, blood vessel images, answering questions, giving further insight to patients there immediately with no delay.
And then what happens after the initial consult happens?
That's a very good question. So the uncomplicated stroke patients who ends up being admitted in the regional hospital, we get the telestroke consultation, and we arrange for all the testing needed, starting the treatment as well with counseling. And we give them the chance to stay in their local communities, close to their loved one, and also arranging a clinic follow-up both in person and virtual clinic visit. On the other hand, if it's a complicated stroke patient, meaning an acute one with potential benefit from intervention, such as the IV clotbuster medication or removing the clot through a catheter or other surgical intervention, then we transfer these patients emergently to Butterworth, which is a certified comprehensive stroke center by the Joint Commission. That's the highest designation or recognition for a stroke center, meeting and excelling in our case, I believe, in all the standards to treat such complicated stroke cases.
And let's talk about those patients and the providers at your rural hospitals. What have they had to say about telestroke services?
Actually, we're getting a very positive feedback from patients, their family, and the providers, appreciating the fact we're avoiding like unnecessary travel or transfer, even decreasing the burden on Butterworth as well. But at the same time, with no delay of care, just providing these consultations, initiating the treatments, ordering the test, and arranging for all the follow-ups, so without losing any time, but still at the convenience of staying local.
All right, let's talk about awareness and prevention. Can you go ahead and briefly explain what a stroke is and why it's important to seek expert care quickly?
Yeah, definitely. So stroke, when you have a clot in one of your blood vessels in the brain or neck, affecting or lowering the blood supply to certain area of the brain, resulting in some symptoms related to the function of the brain area affected. It might affect anyone, any age, at any time. So we commonly use these acronym you're seeing on the screen, the BFAST, B for balance, like gait mainly, E for eyes, loss of vision or blurry vision, F for face drooping, A for arm or leg weakness or numbness. Key here always like sudden onset, and speech for communication or any speech difficulty, and most importantly, T for time to call 911, as we want people to call as soon as possible. So we get patients to the hospital. Even as a first responders, they initiate treatment in the ambulance, so emphasizing the urgency to call 911 and get them to the hospital by ambulance instead of driving, for sure. And then hopefully getting the acute treatment, again, such as the clotbuster medication through the veins or taking out the clot through catheter, hopefully limiting the brain damage, decreasing the likelihood of higher disability in the future.
All right, and wrapping up today, anything else you'd like viewers to know?
I would say prevention is key. So definitely healthy diet, focusing mainly on what we call like whole food, minimally processed, predominantly plant-based. Exercise daily, doesn't take much, just up to 20 to 30 minutes of walking, lowering blood pressure, lowering blood sugar. These are the key to prevent stroke. And also would like to mention that I believe at Butterworth, we're treating more stroke cases than any other site in the state. And we're working tirelessly to improve acute stroke recognition, evaluation in all of our regional hospitals using artificial intelligence for imaging and getting all these regional sites to be certified as primary stroke centers, meeting the standards to improve outcome for stroke care. We already started with Zealand Hospital, which became like a certified primary stroke center a couple months ago, Big Rapids soon, and hopefully all the other sites to follow after.
Well, thank you for all that you're doing.
Thank you so much. Thanks for having me.
Absolutely. Make sure to download the Spectrum Health Stroke Guide, spectrumhealth.org/stroke strong. We'll be right back.